getting so many questions about symptoms and how contagious COVID-19 is. Infectious Disease Specialist at Hospital of Central Connecticut, Dr. Henry Anyimadu, joins us live now from Hartford Healthcare Studios. Doctor, thank you for joining us.
Thank you for having me.
So tell us, are there new symptoms now? What are some of the new symptoms we might be hearing about for COVID-19, doctor?
So the cardinal symptoms of COVID-19 that we know of is fever, shortness of breath, and cough. But we are seeing more and more patients, about a third of patients coming in with gastrointestinal symptoms, including nausea, vomiting, diarrhea. We are also seeing, again, about 25% of patients coming in with neurological symptoms, including headaches, dizziness, loss of the sense of taste and smell, and also even sometimes strokes. We've also seen patients coming in with conjunctivitis or pink eye. We've also seen patients who come in with chest pain as well, or chest pressure. And all of these symptoms could be the presenting symptom of COVID-19.
Interesting. All right. It is allergy season, so how can someone differentiate allergy symptoms from COVID-19 symptoms?
That's an interesting question, and that's a very good question for our season because we know that we are in allergy season. So some people can tell the difference between their allergy symptoms and respiratory illnesses or colds. But I will strongly encourage everyone that in the middle of a pandemic, a COVID-19 pandemic, if you do have any respiratory symptoms at all, be it runny nose, sneezing, sore throat, cough, I think it's very imperative that you talk to your clinician or talk to your primary care physician so that you can make a decision to either get tested or go to the hospital. Because knowing that these symptoms are COVID-19 symptoms as opposed to just common normal allergy symptoms, it's very important because then you can self-isolate.
All right, here's another question. Can people who recover from COVID-19 be able to transmit the disease to others?
So what we know about COVID-19 is that people can transmit the infection in the pre-symptomatic phase, the symptomatic phase, and immediately after recovering from the illness. We know that viral RNA has been isolated from the upper respiratory and lower respiratory tracts of patients who have recovered from the illness. But it's important to note, though, that isolating the viral RNA does not necessarily mean that those are viable virus that can transmit an infection to someone else. So while we do know that the virus can be isolated in patients who have recovered from COVID-19, we do not fully understand its role in transmission.
Okay, and finally, if someone has the virus, how long can they shed the virus? How does that work?
So there's been multiple studies, and one study from China did say that they were able to isolate the virus from patients who have recovered from COVID-19 even up to 8 days. And there was another study that suggested that they could isolate the virus even up to 30 days. So we don't fully understand how long people who recover can shed the virus for. But as I alluded to earlier, shedding the viral RNA does not necessarily mean that they are shedding a viable virus that can transmit or infect someone.
All right, good information, Dr. Henry Anyimadu. Thank you very much for joining us once again.
Thank you for having me.